The Affordable Care Act is changing not only the financial aspects of medicine in the U.S., but the way that providers practice. We've spoken to 2 orthopedic surgeons about the way that total joint replacement surgery is changing for their patients due to healthcare reform, and what this means for the healthcare team. Joint replacement procedures, particularly knee arthroplasty, are becoming increasingly common in older adults who wish to remain active. Due to the aging American population and the propensity toward being overweight, joint replacement is projected to continue to increase. According to a study done by Stephen Kurtz, Kevin Ong, Edmund Lau, Fiona Mowat, and Michael Halpern, the number of primary and revision joint arthroplasties performed will increase by over 600% for knees in the year 2030. The basic concept of knee arthroplasty is that the joint is resurfaced to reduce pain and increase mobility. However, there are many different ways to accomplish this end result. Surgeons have preferences for different systems that are produced by various manufacturers. Each system has similar price points, but there are many factors that influence the current cost for patients. This means that there's a wide variance in cost for the patients, depending on the system used, the facility where the procedure is performed, along with many other factors. This also means that nurses who work in facilities where multiple surgeons operate must know how to care for the patients using the preferences of each surgeon. This can be as simple as a post-op bandage or as complex as a cocktail of medications to give at very specific times during the surgery, including reminding the surgeon when it needs to be given. Surgeons have enjoyed the ability to offer patients their preferred system of joint replacement. They have had much freedom in selecting what is used on each patient, from the biomedical system used to the types of suture used to close, medications, drains, and post-operative care. One of the surgeons I spoke with revealed that she's been through extensive training on being efficient. She has spent a lot of time researching the perioperative care that will allow patients to return home as quickly as possible. The benefits of this aren't just reduced costs for the inpatient stay, but also reduced risk of nosocomial infection and increased independence. The healthcare team must be mindful of what is best for the patient financially as well as medically. The Affordable Care Act is also influencing the care that patients receive because surgeons are being encouraged to standardize their treatment to better align with bundled payments. According to the Academy of Orthopedic Surgeons, orthopedic procedures such as joint replacement surgeries are well suited to bundled payments. In the bundled payment structure, patients will pay one fee for the service that will be distributed through the system. This has sparked much interest in cutting costs for hospitals to minimize lost revenue, since there will be a finite amount of income to be shared. The downside to this plan is that it limits the surgeon's ability to provide their preferred care. The 2 surgeons I spoke with are not in a shared practice, but are both health system employees. Because of this, they are pressured to standardize the care they give. They have not been forced to choose the same joint replacement system yet, but they have been asked to use the same perioperative medications, bandages, and post-operative physical therapy plans. This somewhat limits the surgeons, but by working together, hopefully their patients will all receive the best care possible. Nurses who care for patients before, during, and after their joint replacements are likely to benefit from this standardization. It should, in theory, become easier to provide care because the nurses won't have to remember what each surgeon prefers and will also have less to remember in using multiple devices and medications. For instance, in 1 week, I may do several different knee replacement surgeries, using 4 different systems that each need to be assembled differently. Each approach requires a slightly different setup, and each surgeon uses different intraoperative medications. Standardizing care will probably mean fewer errors and increased efficiency. Providers and hospitals can also gain financially by controlling costs and striving for efficiency. The surgeons I spoke with have worked intimately with other members of the healthcare team, such as pharmacy, anesthesia, and nursing, to reduce postoperative pain. This will allow patients to become mobile faster and ultimately reduce their admission length. This type of collaboration and innovation is beautiful, benefits patients, and was driven by healthcare reform. The bundled payment plan is a challenge that needs to be met with creativity and effort on the part of hospitals and healthcare workers. By making the most of this challenge, healthcare providers can help people both as patients and consumers, utilizing a truly holistic approach.